This is the online video tutorial for Fotona UK and Ireland. It is used to complement the hands-on manufacturer training in conjunction with the Fotona training booklet. This is aimed to be a refresher and cannot be used as an alternative to the hands-on manufacturer training supplied by Fotona UK and Ireland. The rosacea treatment protocol that Dr. Phillips has put together combines a few different modes across the interface. So step one, we're actually tackling facial thread veins. So we're going to this section here, face, opting for about a medium vessel and going forward like you would with just treating facial veins on their own, working between 160 and 200 joules at a 10 millisecond pulse duration and a nice low controlled speed with a 2 millimeter spot. Step one of the rosacea treatment protocol is treating facial veins to any broken capillaries that may occur, typically around the chin, nose and sometimes across the cheeks as well. So just like your facial vein protocol and technique, you'll be tracing along the vessels, looking for blanching and discoloration, adjusting your energy settings accordingly. We're using a very, very high level of cold air for patient comfort, and what we're looking to do is move in a very slow and controlled way, tracing along the vessel, trying not to overlap or stack the shots, and once we've applied the laser, we'll give a little bit of compression just to see what response we're getting. So what you're looking for is you're checking for any blanching, any change in colour, so darkening of the vessel, or ideally you're looking for the vessel to disappear completely. So here we go. And depending on the response, you can alter the energy or you can alter the pulse width of the laser. Once you've treated the broken vessels on the face, you can then go into NDAG screen again and find your rosacea preset. You can see it's then going to ask you what handpiece you're using. We'll be using the R33. And moving on to our treatment protocol screen. So I would be taking down the energy initially to about 30 or 35 joules. 25 millisecond pulse duration is already preset, and you'll be looking to use a 4 millimeter spot. So removing the 2 millimeter by simply popping that out and replacing with 4. In terms of speed, you can choose a speed anywhere between really 4 and 6 hertz. This will depend on your confidence and how quickly you like to work. And then once that's set, you're good to go. Our next step in the rosacea protocol is treating the sebaceous glands, helping to reduce any excess oil or inflammation on the skin. And we're going to be doing this again in a fast, sweeping motion with cold air. We're looking for full face coverage, and ideally you would want to give about 9 to 12 minutes on this step. This can be increased or decreased depending on the patient's needs. Often patients with rosacea can have open pores, so you can also concentrate this setting on the T-zone area or across the cheeks or wherever they may be. And taking up on the forehead as well. Having completed the rosacea setting, what we're actually going to do now is come out of that and we're going to go to our 4D facelift protocol. What we've done is we've incorporated 2 of the 4D settings to really enhance the rosacea treatment, help to calm the skin and also give the patient a lovely, smooth, glowing finish. So we're actually going to use the FRAC 3 skin rejuvenation step. To help further reduce any redness or inflammation on the patient's skin, we've incorporated the FRAC 3 skin rejuvenation step from the 4D facelift. As similar to the last step, we are using fast sweeping motion across the full face for a very similar amount of time, 9 to 12 minutes ideally. So you would continue that, like the last step, across the whole face, chin, nose and forehead. Having done the FRAC 3 skin rejuvenation step, we're going to finish the rosacea protocol with another borrowed step from the 4D, which is the ultralight peel. So we return back to the screen, you'll find that as step 4, confirming that we're using the PSO3X and setting that as you would for the 4D. Final step is the light peel. Again, in a controlled sweeping motion without any little gaps, we're wanting to apply the laser and see white dots of dead skin cells lifting away. So make sure you get that response as you're treating to know that they're getting a really nice thorough exfoliation. The patient can have the cold air again. So here we go. And just like the 4D, this can be done up to 3 passes with wiping over between passes the damp pores. Please refer to the training booklet where you will have further information on treatment protocols and device presets.